Hello, everyone, and welcome to another podcast episode of the Empowered Badass. I'm Ophelia, your aerial coach. I have been teaching for over a decade, but I have been with the circus art for well over 30 years of experience. So what I've done is bring all my expertise and knowledge onto this lovely platform, and I hope that you will enjoy it too. Let's talk today about the anatomy of an invert. We're gonna get a little bit into the muscles that help work into your invert. So this is gonna get a little bit nerdy in terms of biology. We're gonna discuss the parts of your body that work into an invert, and I will also supply some recommendations on how to work them. So if you don't know, first of all, as I said, I've got 30 years of experience in the circus and performing industry, and I started as a gymnast, and I also have overcome a fair amount of corrective surgeries, which led me to spend a substantial amount of time with physiotherapists. The reason for me becoming a coach was because, first of all, I could not find a personal trainer that was understanding of my needs, that was understanding of my journey, and so I decided to become my own personal trainer. The reason also is because I've noticed when I was trying to come back to aerial practice, which was around 2013, I was actually struggling to understand what I needed to work. When I was younger and when I was little, I was being given instructions from coaches, and that was much easier for me to just follow suit. I didn't have a lot of explanation, and I was struggling a little bit when I went back into it. The thing I really remember, obviously, are when all my physiotherapists helped me understand why we were doing certain exercises. And as a personal trainer, I really learned to hone on these skills in a way that was helping me as an aerialist, because I have a few issues, such as a lower back issue, a bit complicated mouthful to say, spondylolisthesis. And I've also got a trochlear dysplasia, which means that my left knee patella doesn't sit in the right place, and I tend to dislocate it a lot. This is due partially to how they've done corrective surgeries and misplaced my knee. So I've had to learn to manage these conditions and ensure that I was training myself sustainably. Obviously, aerial doesn't come without risks, not just like dangerous, but risks of getting injured, because we do a lot of complex dynamic movement. And the reason why I became a coach for aerialists, a personal trainer for aerialists, is because I wanted aerialists to learn to appreciate the work that you can do on the background of your aerial classes in order to train more sustainably and progress faster. When I talk about the anatomy and invert, we're going to discuss the different muscle groups and the muscle that work, because you need to bring a bit more awareness onto what part of your body actually needs to be developed and how can you become a bit stronger. So for example, if you tend to struggle with straight arm, straight leg invert, or if you just struggle to pull yourself and you're a beginner and you don't understand how that works, then this can be for you, because it's important to understand practically when you do an invert what really gets involved. And the key muscles that are involved in aerial inversion, unfortunately, I would say, is your entire body, but we can dive into isolating a few more for you. The way I explain to my student and my client as well, who are fellow aerialists, is how do you break down more complex movements, understand the functional anatomy behind them, and then go to the gym and do more isolation exercises that will break down the movement. The way it helps you, first of all, by isolating the movement, you help just work the strength exclusively on the movement. So if you go and do an invert, you are going to start different part of your body, and when you go to the gym, you're going to separate and split those body parts and work them individually. And when you start coming back into your invert, you're going to see the progress, because you have worked individually and your body connects the dots a lot faster. This is why I've created programs such as the Aerialist Starter Toolkit and the membership platform, the Aerial Performance Lab, is because I really do believe in the benefits of having a structured gym program outside aerial classes. The answer is not always more aerial classes. Now, let's have a look at this. Understanding the fundamentals of your anatomy in aerial arts, it helps you understand what requires for strength and control. It's really important to understand this, just not for your safety, but also in order to bring a bit more smoothness and flow into your movements. And also understanding this will eventually help you possibly prevent more injuries. But remember, you can prevent injuries to a level as well where if you keep overtraining, you will keep getting injured. Right. So targeting and strengthening the key muscles involved, it will set you up for success. As I explained just before, if you understand which muscle you might be struggling with when you do an invert, and if you need a bit more of a push, you need to analyze which muscle group can require a bit more work outside the classes in order for you to then come back to your class and feel the benefits of it. The first, obviously, key muscle groups that work together are the core muscles. The core muscles are composed of the rectus abdominis, the obliques, and your transverse abdominis. There is a lot of depth. Obviously, I consider the pelvic floor part of your core, and I consider your diaphragm and even sometimes a little bit your serratus anterior as part of your upper core muscles as well. Because in aerial, we do brace a lot from the chest as well. We brace a lot from the shoulder blades, and we need to connect the pelvis and your rib cage towards each other in order to really hone onto the depth of your core. Obviously, the core is a foundation for all inversion. It stabilizes your spine, it allows control movement, it allows to lift your legs overhead. The rectus abdominis, which is the six pack, is responsible for your spine flexion. You still need a strong rectus abdominis because you will really fold yourself. Your obliques and your transverse abdominis, they work together to stabilize and rotate your trunk. So when you do things that require stabilization, when you do your inversion, for example, in hoop, the most common would be obviously your straddle invert. You still need to stabilize yourself so you're not going side to side, and you're able as well to pull yourself upside down. Obviously, everybody knows how to get stronger core. We do need to work exercises like hanging leg raises, planks, hollow body, the holds, and many other exercises there might be into your conditioning when you're in classes. That's kind of like the standard practice. You can also at the gym make them a little bit harder by incorporating weights into your core training. In my aerial classes, we actually use weights in my warm-up and my conditioning exercises to spice up and tune up a little bit more the training for my students. And my warm-ups and my conditioning are pretty hardcore. Just bear in mind that if you go and check out my YouTube videos, or if you start a toolkit, you will actually figure out that my warm-ups and my conditioning exercises are quite difficult. So the next one obviously will be your hip flexors. Your hip flexors are obviously helping you with lifting the legs towards the torso when you do an inversion. Again, it helps as well connect your pelvis a little bit closer to your rib cage, and it helps also finding better pikes and holding and finding also any other poses that requires a bit more flexibility. My training tips for your hip flexors obviously will be what you do as usual into your conditioning, such as leg lifts, mountain climbers, L-sit holds, and so on. However, I also do promote the benefits of doing leg press exercises, really find that depth. It also helps you with good gazelle movements and good strong gazelle, but it will also help strengthen your hip flexors. Good squats and good leg press can really get you a bit stronger for your legs as well. Remember as well that your iliopsoas and your rectus femoris, the rectus femoris is kind of part almost of your thigh. Yes, that's like the quad a bit more. Your iliopsoas major and minor, they attach from the last vertebrae of your thoracic spine, and it's very connected to your diaphragm muscle, how you breathe, and it goes all the way down behind the depth of your core, and it connects only on your femur. Very often when you feel the hip flexor, we'll feel it into that crease of the thigh, but do bear in mind that your hip flexor do actually go quite deep, and it's a really big muscle. The next one that I like to talk about is obviously, I've got two muscle group that I really like is your latissimus dorsi, which is your lats, and my favorite, which is a bit like the underdog of aerial strength, your serratus anterior. If you're a student of mine, I think I've regurgitated serratus anterior training and explanation so many times. The serratus anterior helps you with shoulder protraction. So what it does, it actually brings your shoulder blades forward. But the thing is, in aerial, very often, a lot of us, from our lifestyle of hunching down and over, we often raise the scapula up. Yes, we have the shoulders rising up. That's the issue that we tend to all come across. We tend to have the upper traps also taking over most of the movement when we push the shoulders forward. If I tell you to round the shoulders, very often the shoulders are also going to rise. We're going to enter a form of internal rotation of your shoulders. However, the serratus anterior is actually scooping your shoulder blade underneath your armpit, and it's a much healthier way to move your scapula. And your serratus anterior starts underneath your scapula, your shoulder blades, near your spine, and it braces it all across. And you can actually see it finish, if you've got a strong serratus anterior, it finish underneath your breast, and it will look like little fingers that are bracing your rib cage together. And this is quite hard for a lot of students to work on, just from a fact that often you will compensate by using your upper traps and you won't be able to hold the shoulder down. It's important to understand how to harness it, not by just pushing forward, but also keep on trying to pull that shoulder down while you round your shoulder blades. That's really how you will feel your serratus anterior working properly. So the two work together, the lats and your serratus anterior, because obviously the lats kind of pull down that shoulder blade, they draw that shoulder blade down. Yes, the lats, they're responsible for your shoulder adduction, extension, and also depression. Yes, so it's really crucial when you stop doing pull-ups, pulling your body upward into an invert. But the serratus anterior is the one when I explain when you do an invert, you do not want to pull yourself up from the chest. You actually want to push the apparatus away from you at the front. You do want to push the hoop forward, push the trapeze forward, push your silks and your fabric, your sling forward when you're about to do an invert, because you need to brace that rib cage, you need to stabilize that shoulder, and you need to pull that core together. And lastly, you also need to use your hip flexor correctly. All of this, you need to connect the top and the bottom of your body. And this is why you need strong lats, strong serratus, strong core, and strong pelvic floor, and strong hip flexors. Those are really working together to lift yourself and fold yourself in half while you're suspended in the air. So how do you strengthen your lats? Well, pull-ups, lat pull down, and do also shrugs. Yeah, so trying to work this sort of scapular movement to try and really teach your lats to pull down, especially when we are slightly imbalanced, us aerialists, left and right. It's important to do these exercises in the gym in order for us to find a bit more stability on the other side as well and rebalance the body. To work your serratus anterior, there are many ways obviously to do this, such as serratus, we call this a serratus push-up, but again, I like to do a straight arm push down or pull down on the ropes, and while I'm kind of bracing my ribcage as well, because it works both my lats and my serratus anterior while you push forward. And I also do, I think I did post that on one of my Instagram posts one day, but I should probably just reiterate this. There is an entire video on my YouTube where I talk a bit more practically of the anatomy of an invert and how to use the serratus anterior a little bit more, such as finding planks or go on all four on a foam roller and pressing through your forearms and trying to straighten your forearms in front of you without letting the shoulders rise up, and really brace that rib cage and push the foam roller forward and bring it back into your forearm plank. This is quite a hard exercise that I teach in my Pilates classes, but really good to strengthen your serratus anterior. Understanding the serratus anterior's function, for me, I think it can be a really big game changer for you as an aerialist. Really harness your serratus anterior and really teach your body to use your serratus anterior instead of relying too much on your upper traps. Now, the last muscle group of your body for an invert are obviously your shoulder stabilizer. It's not the last one I'm talking about. Last upper body, it is your rotator cuff muscles. And it's still important to discuss this because the injuries of rotator cuff are so common in aerialists. And why do they happen? First of all, the rotator cuff muscles, supraspinatus, infraspinatus, and teres minor and subscapularis teres major. Those are very mouthful. Yes, you have your supraspinatus, infraspinatus. They're all located at the back. The teres minor is connecting to the shoulder. You got the teres major as well that is connected to the upper part of your lat, and your subscapularis. The subscapularis is a muscle that sits in front of your scapula. On top, you've got all these muscles that you can visibly see when you see images of your back, but the subscapularis is the one that sits behind. You can actually reach it through your armpit. If you like, I don't always recommend it because if you don't know how to manipulate and do SMR in your subscap, it's a little bit tricky because you don't want to reach, but there is a way to reach into your armpit and find your subscapularis, and it is connected to the front of your scapula. Again, the subscap as well helps with that sort of push and bracing those lovely scapula a little bit more under the armpit rather than letting them go over. It's also important for us to have good, healthy internal rotation and an external rotation. In aerial, we use both. When you skin the cat, you do an internal rotation of your shoulder. When you do a German hang, you do an external rotation. When you do an invert, you tend to turn into an external rotation because you want to break the bar of your hoop. You want to try and turn your biceps back, push the hammock forward. That's an external rotation. But we have to work the strength of our rotator cuff because very often we do get rotator cuff tears, overuse injuries, tendinitis, rotator cuff and shoulder impingement syndrome. Yes, those are very common issues that we get as aerialists, and it's so important to do exercises that strengthen and stabilize your rotator cuff muscles. So obviously you can do a lot of exercises that are a bit more feeling like rehab, such as rotator cuff with the bands, with the cables and so on. Again, I do like also that foam roller that I was telling you for your serratus anterior, and also do other small exercises that might be isolating your rotator cuff muscles, such as reverse flies and so on. Let me just remind you that the reason as well your rotator cuff might be feeling the strain of overuse is because you use your rotator cuff too much as compensation. Instead of using your big, larger group muscles of your lats, your serratus, your hip flexor and your core properly, if you don't use these big muscles properly, if you don't learn to condition and strengthen those big muscles, your smaller muscle, the rotator cuff muscles, are way small. They're not meant to be taking a heavy load. They are only there to help stabilize, but they're not muscles to bear a load and to instill movement, if that makes sense. When you do a shoulder movement, you need to start really bringing in mind how important using your bigger muscle, even if it's your traps, your lats, everything is more important to harness this strength. And so you will avoid in the longer term putting strain over the smaller muscle that can help the teres minor, your infraspinatus, the teres major. They can really feel the strain if you are constantly putting pressure on them and if you're not strengthening them. So my recommendation is always make sure that you really work on strengthening your larger muscle groups, and you do some prehab and rehab for your rotator cuffs in order to work a bit more their stability. And obviously, again, as I was saying, overtraining can be also a major issue for rotator cuff injuries. All right, now let's move on to the lower back muscles, the erector spina, obviously, which runs along your spine. It's like this big muscle that comes on the side of your spine. They are responsible for extending, stabilizing your back, and also when you do a flexion of your spine, they will stretch. You do need to have quite a nice stretchy erector spina. In aerial inversion, they do help to maintain the alignment. They help with preventing excessive arching or rounding of the spine. They stabilize your spine. So when you do an invert, for example, a straddle invert on a hoop, we do tend to turn your shoulders out and try and stack the spine in a bit more of a straight way, because when you have the spine rounded, it's much harder to stabilize everything. You need to have a very strong core, very strong shoulders. But when you start pulling it a bit more upside down, I always call it an upside down twerk, because you do want to stack your spine and almost tilt that tailbone a little bit out in order to really find that stack spine. Once you hold into that invert, for example, a pike can feel a little bit painful because your erector spina needs a bit more work to make sure it's stabilized, but it needs to be supported by your lats as well, and your serratus anterior, and your core, and your hip flexor. So how do we train this? Obviously Superman back extension, but deadlifts as well. Deadlifts, because you have to lock those lats, you have to lock your back. Those exercises help with your spinal alignment. I also do like doing bent over rows and any other kind of row exercises that strengthen the back muscles in synergy. All right, lastly, let's discuss a bit of the glutes and the hamstring. You might not think that in an invert, the glutes and the hamstring are important, but I still want to discuss the role of the glute and the hamstring. They help stabilize the pelvis, especially the glutes. They extend the hip. Yes, so they open the hip flexor. They play a crucial role in holding your inverted position, preventing excessive anterior pelvic tilt, meaning arching of the lower back. Having a good glute and hamstring strength will help stabilize your pelvis. But also, for example, if you are someone, even in silks, I don't really do silks, so my specialty obviously is aerial hoop and trapeze. But single leg hocks, yes. If you are struggling with single leg hocks, you do need a strong hamstring. Indeed, you need strong glutes. If you have tight hip flexor, you need to work these muscles as well, because they are antagonists of your hip flexor and your quads, meaning that there is something called reciprocal inhibition. The more you strengthen one muscle and you learn to contract, the muscles on the other side have to learn to relax. Obviously, glute bridges, deadlifts, hamstring curl, hip thrust. I love a good hip thrust. So useful for aerialists, so useful in your front balance as well, to have strong hamstring, strong glute. I really do like that glute ham machine where you stick your feet in and you have to tuck that tailbone under and strengthen through the glute and a hamstring to hold you like a front balance. Remember that the front balance is not just all the upper body. There is a lot involved in extending your legs properly and really squeezing those glutes and a hamstring. I always tell people to first lift the legs higher and get this hamstring, the glutes to work, and imagine that you are a bit like a seesaw and you transfer your body weight when you do a front balance, rather than stay down with the legs and lift the upper body. You kind of work into that seesaw system. Not only you work a bit more better your center of gravity, but you activate a lot more of your muscles in the posterior chain. Instead of putting the strain on your back, you also use the glutes and the hamstring. And obviously, when you are wanting to get stronger for your single leg hocks, where you hang from one leg, the deadlifts and glute bridges, but also the hamstring curl, I was saying that again in my class last night, there is nothing more effective than a good hamstring curl exercise to strengthen those hamstring. But just remember as well, when you do the hamstring curl, I've noticed a lot of people use the hamstring curl with an anterior tilt. That means they're arching the lower back a little bit because they want to put a lot of weight. They want to show off. They want to show that they have a lot of weight on it, but they're not actually performing the muscle, the movement in full range. That means that you will probably work the insertion part of the muscle, which is near the knee, but you won't actually work the origin muscle of your hamstring quite well. That means you have to learn to tuck that tailbone under a little bit and squeeze the glutes when you curl your heel towards the bum. And is because when we hang upside down in hocks in aerial, we don't just relax the glutes, right? We don't fold from the hips. We stay straight, we squeeze the heels to the bum, and we squeeze the glutes. So when you work your hamstring curl to strengthen for your single leg hocks, you do want to produce the same alignment first before you start kicking that leg into the butt, to your bum cheeks. So yes, I think we obviously worked on the anatomy. I've described most of the muscles that work into aerial. Now, obviously, how do you keep on training for aerial inversion? Your strength, your control, and your stability. Obviously, you do need to implement not just core strength exercise, but you also do need to work on your upper body strength. However, a lot of us aerialists always think upper body is the most important, and yes, it is really quite an important part of doing aerial. However, it's important to not neglect your hip flexor and your leg strength as well. The stronger your legs will be, the easier those single straight leg lifts will happen. And it's also good to keep up with lower body strength because it helps with your flexibility as well. The stronger you are, the more flexible you are actually going to become. Trust me on that. And obviously, training for shoulder stability is important, as we explained. Yes, it's quite an important part of preventing your injury and building a bit more sustainability in your training. And overall, you all still want to keep a lovely flexibility and mobility routine. The way I design program as a coach, as a PT for aerialists, I do tend to have in my workouts a block that is strength with between 1 and 3 exercises, and then I work a part that we call accessories, which are in superset. That means exercises back to back, so 2 exercises back to back twice. And you will do this in accessory. You lower the weight, you put a bit of a higher rep, and you work on your technique, your engagement, maybe use a bit more a negative. You will take a bit more control in your movement, and those are accessories. After, if the person has time, we do a finisher, which will be in as many rounds as possible, a core exercise, a conditioning of some sort that will work a bit more on the core strength. Most of the workout I tend to give to aerialists are whole body approach, but you can also do a split where one day you work on your upper body, one day you work on your lower body, and you can repeat that another round. So if you do work just 3 times per week, for example, you can do an upper, a lower, an all over body, or an all over body 3 times a week. At the moment, that's what personally I do. And you implement between 5 and 15 minutes of conditioning as well. I would say try and implement this even outside your classes, and if you have time after classes or after your workout, because the workouts that are prescribed generally do not last longer than half an hour. You try and do half an hour, you have a 5-10 minute AMRAP, is also to spend a substantial amount of time working on your rehab. So you can either do prehab, like I said, to work on your shoulder stability, or do a bit of mobility work beforehand. Or you can also spend a bit more time stretching afterwards and doing a bit of SMR as well. It's up to you to build this routine that works for you. Try and not stack up too many things at once when you start working. Like I said, maybe start focusing on elements that you need to work on. If you know that you have a bit more work that's necessary to do on your hip flexor, then maybe just start implementing a lower body workout for yourself. And if you know that you need a bit more upper body strength, or that you've been struggling with shoulder pain, then a bit of a shoulder stability rehab complemented with some exercises at the gym for your upper body strength can really help. So this is why also I do recommend that you break down in smaller exercises and that you do at the gym. So it also gives you a bit more of clarity of what is happening in your body, because when we are on the apparatus, we don't always see, we just move and we're not always aware of what we need to do. Even me as a professional who's been doing it for years, I can sometimes need someone to tell me what I need to work on. So obviously, never forget to warm up thoroughly, to progress gradually, be patient, enjoy the process, and focus on your alignment and your technique as well whenever, as much as you can. It's okay when we get tired at the end of the class, but focus on that, and obviously stay safe. So obviously, with inversion, the stronger you get, the more satisfying it gets, because you can also notice how good your stamina becomes with other moves. So I do really recommend that you spend time understanding your inversion, because I know as someone who has been skimping a lot on getting good inversion, it took me a long time to get a good straight arm invert. And don't skimp on that. Even if you get better at the other stuff, really learn to hone a good invert, a good straddle invert, and a good invert to climb. Yes. So obviously, as I explained, all these techniques and all these little workouts that I've designed, and I designed for my clients, I design them for you as well. I have created a platform called the Aerial Performance Lab, and it is packed with resources, including nutrition resources, workbooks, SMR program, rehab program, mobility programs, strength program, gym program, and also programs that are body weight, such as the Aerialist Starter Toolkit, which is a conditioning program for beginner aerialists, but we can all do it. It's a lot of conditioning exercises. and also even aerial strength maintenance that you can do at the gym. And I have done a special program that I've called Invert Power, which includes exercises like I've told you in this podcast, made in a way that where you can build true invert strength. So do not forget to have a look at my website or fitfrenchkids.com, or from my Instagram. Everywhere you find me, there will be obviously links to this. And always make sure, if you want to know more, there is the blog in the show notes of this podcast. And don't forget to share it to friends that would benefit from understanding and learning about this. And thank you so much for being part of this journey with me. And I will see you in the next episode. Bye.